The number of shoulder, elbow, and wrist injuries in gymnastics is insane. It is just mind-blowing to see how many kids struggle with upper extremity injuries, and it makes a huge impact on so many aspects of their life. Obviously, from a performance point of view, these athletes lose tons of time in training. They're not able to do the skills they want to do, and they can't really progress because they're always limited by these problems. But also, it makes a massive impact on their life in general, their mental and their emotional health. They can't be with their community. They can't be a part of their team that they love to train with. And when you look at the sport of gymnastics, it kind of makes sense of why there's so many upper extremity injuries, right? We have a super high force sport. Skills that they're doing are incredibly high repetition and high flexibility demands, but then also they're doing them at a time when they're really at an at-risk growth period. A lot of these athletes are underdeveloped, or they've gone through a long career and they have, progressive shoulder or elbow problems that are kind of snowballing on top of each other. And not to mention, the sport inherently puts really large demands on non-weight bearing joints. It uses the arms as legs. And so as a medical provider, this is very, very overwhelming and very stressful sometimes because there's not a lot of great research out there on this. There's not a lot of really good protocols to follow. We have some really good ideas from other sports, but there's really no specificity for what gymnasts need to get back to these crazy swings and these crazy skills they're doing. And I know exactly what people are going through. I know exactly how frustrating it is and exactly how stressful it is, because when I was first starting out in my career, I was trying to help gymnasts. Being a gymnast and having been a coach and stuff like that, I tried my best to help, but I really didn't feel like I found a lot of good guidance here. I spent a lot of time trying to find research on rotator cuff tears and slaps and OCD surgeries or gymnast wrists, right? These common things we deal with, and I couldn't really find anything. I felt lost. I felt completely overwhelmed with not having answers or not knowing what to do. And so despite my best efforts, I was still seeing gymnasts struggle with pain. They didn't have flexibility increases they need. They weren't really able to get back to training, and they always had constant nagging issues in their elbows, their shoulders, their wrists, and it kind of felt like the main limiter to their progress. And so, it was already hard for me to kind of help athletes that I was seeing on the patient side, but I was still coaching at this time, and this really all came together when I had a case of one of our own optional gymnasts who started to really struggle with biceps and rotator cuff irritation and a slap tear as well. And so, I was trying to do everything I possibly could that I knew from the research that I had studied and other books that I had gone through, and I just didn't really feel like I was making progress, and it kept getting worse and it kept getting worse, and unfortunately got to the point where she needed a big surgery. She had a rotator cuff debridement, she had a slap repair and a biceps tenodesis, she had a capsular shift, like a really major surgery. And it was hard because we were trying our best to do a nice evidence-based rehab protocol, but she always struggled to get back into it. She couldn't really do all her advanced bar work, and it hurt to do tumbling that was really powerful and things of that nature. And so she really struggled to get back, and eventually what happened is over the course of time, she just kind of wasn't able to finish her career the way she wanted to. She was really held back by her shoulder. She could only do a few numbers, and we didn't really ever get to the point where she could maybe have a decision or a conversation about, do you want to keep doing gymnastics in college or like that, because she was like, I just can't do it. My shoulder is just not going to let me do it. And that was really hard for me as a clinician and as a coach, because I was supposed to be the person who was really knowledgeable about this and had all these great resources and was like the guy for gymnastics, and I really felt like this one was a total failure. And I, despite my best efforts, I realized that there was really so much more I needed to learn. And so after that case kind of came through when I was younger, I said, all right, this is not working, right? We need something new. We need a different kind of approach to shoulder and elbow and wrist rehab that's going to be evidence-based. It's going to be, gymnastics specific, but it's also going to be something we can use practically in the clinic and in the gym to make sure we're giving the athletes everything they need. And so I kind of tripled down on my studies, and I went back. I took a bunch of courses online and in person. I read a whole bunch of books. I went through the entire body of literature on shoulder, elbow, and wrist injuries. And I also, found some mentorship. Mike Ronald and Lenny Macrina, who are internationally renowned for this. I'm lucky to have his mentors, and it was with them that I started really rethinking about how we were doing this for the sport. So after 3 to 4 years, we started to really feel like we were getting somewhere. We felt like we were helping athletes with reduced pain. Their function was better. They were able to get into the high levels of strength conditioning we wanted, and they were able to get back to some of the gymnastic stuff that previously we thought was not going to go well. And so we were really excited by this. And for me personally, it kind of all came around full circle when, 5 years later, I had another athlete who started to have similar symptoms of what that athlete had earlier. She was getting some shoulder pain with shoot overs and releases and tumbling, and I was a little worried. I was like, oh man, this is going to happen, all over again. But thankfully, with the system that we built, we put her through the evaluation, the progressive loading, the return to sport programs, and she actually had a fantastic outcome. It took, 3 months to really get her back to where we needed to be, but she was in the later stage of her career, just like that first athlete. And because we had a different system in place, she was able to continue training. And for this athlete, she had loved gymnastics in college and really wanted to go there. So that was her goal. And thankfully, this wasn't something that limited her. She was able to go back to all of her skills and tumbling and beam and all that. And we were really happy to see her, be able to go and enjoy a successful college career. And I think that if I hadn't have had these systems in place, I probably would have had a repeat of history and probably had someone struggle again. So it was a really tough case because she was that lax instability, kind of, overwhelming progressive onset, and we didn't really have great research behind it. But with what we had learned, it came together really, really well. And for me personally, as a clinician and as a coach, man, that felt awesome, right? I felt like I really knew what I was doing. I was confident in the things that we were doing. I knew they were evidence-based, and I really had a step-by-step progression to what I thought was going to help her, and it worked out really well. So now looking back on the last, 5 to 7 years, I want everybody else to have the tools that I have. I want everybody else to have the great ideas and the exercise progressions that I learned from Mike and from Lenny and from people that really helped me out. I don't want them to be limited at all by having to, spend thousands of dollars on books or courses or drive somewhere or, have to go into these long, in-depth mentorships to try to get it. I want people to be able to learn it right from the seat of their home, right? Just at their own pace when it makes their time fit schedule best. And that's what we did here. So we took everything that we had in our system and the way that we approach shoulder, elbow, and wrist issues, and now we're putting it into a step-by-step course that people can follow. So it's going to start from the very beginning with an introduction, a literature review, what are the forces of gymnastics, what are the things that we need to know from a pathology and testing point of view. But then we're going to go break down everything we do for all of our shoulder assessments, our passive range of motions, our stuff like that. How do we actually set somebody up for success? And then we're going to go all the way through the subacute phase and the acute phase. We're going to go through the advanced phases, the strength conditioning phase, learn how to get back to weight bearing, learn how to get back to hanging. And then we're going to build custom return to sport programs together. I'm going to teach you exactly what I do step by step to get somebody safely back to gymnastics, and then give them some prevention or some maintenance care strategies. So, I feel like this is going to be something that really helps people, and I'm so lucky and grateful that I have these ideas, but I want everybody else to have access to them. So I think the clinicians jumping in here are really going to feel confident. They're going to know exactly what to do, how to handle these tough situations, and they can then provide these really good programs for athletes that are trying to get back, and they'll find that if they use these protocols pretty well, they'll get less pain, they'll have a pretty good quick outcome, they'll know what they're doing, they'll feel confident, and they won't have that stress and frustration as what they used to have. And so that's what we're trying to do here, and this is the reason we made it, and I think it's really going to be a game changer for people.